What do porcelain veneers cost? Hi, my name is Carrie Gans and I'm a dentist here in Garden City, New York. This is a question I get all the time, so rather than just going ahead and telling people the answer one by one, I thought I would do this brief video. So let's start talking about what do porcelain veneers cost? Well, this question comes up all the time, as I said, but unfortunately the answer is not all that simple. Stop. Before we can talk about what porcelain veneers cost, we need to discuss the concept of porcelain veneers in general. So let's talk about what are porcelain veneers. Well, porcelain veneers are basically a cosmetic covering of a tooth. If you think about it, they're very similar to the fake fingernails placed on a woman's finger. There are a couple of differences, well, besides the fact that they're placed on teeth. Porcelain veneers are made of, obviously, porcelain. There are acrylic veneers, but they do not typically possess the same level of cosmetic enhancement as porcelain veneers. Acrylic veneers tend to stain easily. They're basically porous. They do not have the luster and life of porcelain, and they tend not to last as long. Porcelain veneers, however, come in basically two different varieties, either prepped or non-prepped. In prepped veneers, the dentist reduces the tooth on the front surface and biting edge approximately a half a millimeter. That's basically the thickness of a fingernail. Yeah, okay, enough with the finger metaphors. The dentist is then able to replace all of the aesthetic requirements by building a porcelain veneer that is also a half a millimeter or so thick. In that way, the tooth does not necessarily change in diameter or size, but rather all of the cosmetic imperfections that you may be trying to hide can be adjusted within just that half a millimeter of porcelain. Additionally, the dentist can also fix spaces between your teeth, rotated and chipped teeth, cracked teeth, as well as teeth that may be congenitally discolored from birth. Non-prep veneers are just that. The veneer is placed on top of your tooth with little or no actual tooth reduction. The advantage of this type of veneer, sometimes called lumineers, is that there is no tooth reduction. It is a reversible procedure compared to prep veneers, which is irreversible. The disadvantage, however, is that this type of veneer has limited use, and only a trained dentist can help you make that decision. Now, all of this being said, the original question was, what is the cost of a veneer? Well, the cost of porcelain veneers depends on several factors. The first factor is geographic location. You may not realize it, but dental fees vary tremendously from one region of the country to another. Secondly, it depends on the skill of the dentist. You see, not all veneers are the same. There is a definite level of skill needed to properly place either type of veneer. And before you make any treatment decision, it's important for you to see actual cases performed by that dentist. Now, don't be fooled. Do not allow the dentist to show you cosmetic books he or she purchased from some company. That, unfortunately, may not be representative of their level of skill, and you may find yourself very disappointed with the final result. Now, the third factor is the laboratory. See, the cost of veneers depends greatly on the laboratory the dentist uses to create the actual veneer. As with any profession, there are very different levels of skill performed by the dental laboratory technician. The actual cost to the dentist varies with that level of skill and personal attention to detail. Now, some of the less obvious factors that relate to the cost are such things as the way you're treated at the office, the time and the way the dentist listens to your wants and needs, and the manner in which the actual treatment is performed. When it comes to cosmetics, shortcuts never work. Now, here are the basic steps taken in creating a successful veneer. Treatment visit 1. The preliminary impressions of the existing condition. Models are then poured, which can be used to discuss the current problems and the possible solutions. Your dentist takes impressions of your teeth as they are now, pours those models, and then you can sit down and go over the problems that you see, because what you see may be quite different from what the dentist sees. From those models, the dentist can create what are known as customized cosmetic wax-ups. These wax-ups basically create the ideal situation that both the dentist and the technician feel are important for you. You can then sit down with the dentist and do a consultation where both you and he discuss the potential restorations and decide upon any necessary alterations. Treatment visit 2. The dentist will prepare the teeth for either prepped or non-prepped veneers. If the teeth are reduced, the dentist should create temporary veneers for you to wear while the final restoration is being created. Now, this can take several weeks based upon the different laboratories, and there is no reason for you today to walk around with your teeth uncovered. They will be sensitive to hot and cold and sweets, and there is no reason for that to occur. Another advantage of temporary veneers made from that cosmetic wax model is similar to taking a test drive on a new car. You get a chance to wear the temps, which are created once again using that ideal model to see if they truly satisfy your needs. If not, there's now time to make any necessary corrections before the final restoration is placed. Now it's basically treatment visit 3. This is where the veneers are placed and adjusted. Treatment visit 4 should occur several days or weeks later, where there's a cosmetic evaluation and finalization of those veneers. This is the time for the dentist and you to make any small changes to the bite and aesthetics that may have arisen since the initial placement. You've now had time to live with your veneers, and any necessary changes can be made at the office. Now, once again, the first question was, what do these porcelain veneers cost? Well, fees can vary very widely, as you can imagine. I've seen porcelain veneers advertised for as little as $750 per veneer per tooth, to a high of $3,000 or more. Just because a fee is high does not necessarily mean it is better. But it is my belief that if a fee is very low, I would suggest that it is almost impossible to provide the same quality of care. When selecting a dentist to provide any cosmetic service, you need to follow a couple of basic rules. 1. Make sure the dentist takes some personal time to discuss your personal wants. If you feel rushed, this is not a great place for you to be. 2. Make sure that you understand the entire process and how this particular office manages a cosmetic procedure. Not all offices are the same. And 3, if the dentist is unwilling to provide temporary restorations for your new veneers, get up and leave. Find the nearest exit. Well, I hope I've given you some ideas about porcelain veneers. Now, I'd love to see you. If you're living in the New York City area and are looking for a true cosmetic alternative, give us a call. There's the phone number right in front of you. We'd be happy to take a look and give you some advice. We're here to help in any way we can. If you'd like to know more about our office, go over to www.gansdental.com. There you'll get a sample of what we can do, some of the thoughts that we have, and possibly answer more questions about dentistry in general. Have a great day, and we'll see you soon.